person will be quick about that. That's David.
Okay, good evening, and I'll call to order the July 19th, 2021 Haywood County Board of Commissioners. This is our regular meeting and the only meeting for the month of July. I just want to make a couple of comments before we start. I meant to say last time that Candy Way was her last time here. She had been our clerk for a long time, and she retired, and she is now is moving to where her friends are and family are. Can y'all hear me?
I believe it's on.
You can't hear him, can you, Sheriff?
Can you hear it?
Scoot way up to it.
I was on it. Can you hear me now? Is that better? Brian, is it okay back there? We'll get him out here. Test. Can you hear it now? Okay. Okay, as I said, I'll call to order the July 19th, 2021 Board of Commissioners meeting, regular meeting for today. And I just wanted to make a couple of comments. Our longtime clerk, Candy Way, is pretty much retired, and she's moved to an area where her family is, and we appreciate all her hard work. And I meant to say something last time when she was here. And also, I want us to remember Tracy Wells, our current clerk, who has lost her husband tragically to cancer. And so I just wanted to, I would appreciate if everybody would remember her in your prayers and your thoughts. Also, I wanted to say that our pastor, Josh Frazier, can't be here tonight because he has a young child with COVID, actually, and so he couldn't be here tonight. So if everyone would please stand, we'll have a moment of silence after the pledge, and then we'll start our meeting. Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Okay, our next order of business is public hearings, and we have two public hearings tonight. The first one will be a public hearing concerning Southwestern North Carolina Home Consortium Consolidated Housing Plan. We have our program administrator, David Francis, and the Southwest Commission Senior Project Manager, Caroline. And Caroline, I'm going to let you pronounce her name. I'm sorry.
Good evening, Commissioners. Just give you a bit of background before Caroline gets started. We started working on this plan back in the spring of 2020. Don McGowan brought this idea to us about forming a home consortium through HUD. At that time, Southwest Commission began working on the program. We put together 6 counties, and the other municipalities under those 6 counties all signed on to do the consortium. Back in February 21, we had written a grant for Dogwood to help mitigate some of the gap that we had to have $750,000. Our qualifying amount was about $542 at that time. Dogwood granted $265,000 to us to be able to get over to that threshold for the first year that we had to receive the home grant. Since that time, we also learned that we received another American Recovery Plan monies of $1.9 million that will be in addition to the funds for this program. And so Caroline and Russ have been working very hard to put this consortium and put the plan together. That's if you saw in your agenda packet, it's over 130 pages long. So it's quite a comprehensive plan. And so the plan will help with new construction, rehabilitation, down payment assistance, and other things to bring affordable housing to our region. So I just wanted to let you all know. This is, Caroline, introduce you.
Good evening, Mr. Chairman and Commissioners. Thank you for having me. My name is Caroline Lafreniere, Senior Project Manager with Southwestern Commission. So as David said, I just have a real brief presentation about the consortium and the consolidated plan and our planning process. And as he also mentioned, the plan is an attachment to your agenda today. So just a brief timeline. We started the consortium in May of 2020. In February of 2021, we held our stakeholder meetings. These meetings were to gather input and hear the housing needs from across our region. After the stakeholder meetings, we began drafting the plan by taking what we heard from those stakeholder meetings and gathering data and all those different things. As David sort of mentioned, this consolidated plan is specific to our region, but it's very much a process that has to be completed to receive these home funds. So we're consolidating all this information that we heard from the stakeholders and creating this consolidated plan. So in August, the first week of August, we have to submit this plan to HUD for their review. So after this public hearing, we'll do that. And hopefully we will receive our funding in September, October, early fall, and then we will have our first application process and the allocation of those funds early January of 2022. So as David sort of already mentioned, the Home Investment Partnerships Program goal is to create more affordable housing options and opportunities in our region, and the consortium includes Haywood County, Jackson, Macon, Swain, Clay, and Graham. So our planning process, we held those stakeholder meetings. We're currently still working on the market analysis a little bit, but we feel sure that that will be complete in the next couple of days. Then we have drafted our goals and priorities, and we're here having the public hearing this evening. And then at the August 2nd meeting, I'll ask for the commissioners here to consider reviewing and approving this consolidated plan, and then we will submit the plan to HUD for their review. If there are any questions this evening, I'd be happy to answer them. We also have Mary Roderick with Land of Sky Regional Council, who has been awesome in helping us draft this plan. If you have any questions for her, I'm sure she'd be glad to answer them as well.
Anybody have any questions on it? I don't either. Okay.
Okay, thank you.
Okay, thank you. Thank you, Caroline. Okay, at this time, I'll entertain any public comment. This is just for this public hearing. We'll have a public comment session later. I do have a couple of people signed up. So would anyone like to comment on the Southwestern Consortium? And seeing no one, I'll close the public comment. Go ahead, Dave. And we'll move on to the second item, correct?
Yes, sir.
Okay.
Yes, yep.
And we'll vote on both of these public hearings at our next meeting, most likely. So the next public hearing we'll have is the public hearing for approval of economic development grant for incentives for Drake Software LLC for a total investment exceeding $200,000 with the addition of 40 new jobs and additional 20 jobs in 5 years. Go ahead, Dave.
Thank you, Mr. Chairman. As you said, these economic development projects take a little bit of time. The first phone call I received from Drake was back in 2018. And we started working with them again. We picked up working with them in 2020. And it's taken this long of a process to get settled in. But Drake Software is a leading provider of professional tax preparation software. So they provide software that accountants use to help file their returns. Last year and this year, Drake has submitted over 33 million filings for tax preparers across the country. Drake has 600 employees in 5 offices, North Carolina, Virginia, and Tennessee. Drake has call centers in Hayesville, Silva, and Nashville, Tennessee. So Drake has leased a building right below us here on Depot Street that they are currently remodeling. One of the things you may notice that the cost of, this investment is not a large investment. So they're leasing the building, and the building was in, very good shape. They didn't have to have a lot of upgrades or refurbishing as well. Another thing that they have is they have an in-house construction company. So they take care of all of their work. They don't subcontract just very few parts of it. They have their own fiber company as well, too. So all of those costs are borne by that company, so their costs are not very large there. So Drake plans to hire 40 employees at an hourly wage of $15 to $18 an hour and 20 employees by year 5. They really hope that this will be even a larger call center. Their goal ultimately is to have 100 employees employed at this call center. That's what they're really aiming for by year 5. So Drake provides multiple levels of health insurance, dental insurance, 401k, longevity pay, and tuition reimbursements as well. Like I said, they have over 600 employees. Over 300 of those work in the call center. So what's very important to Drake is that they have a 2-second rule. The person on the other side of the phone call is only going to wait 2 seconds before they pick the call up and answer those questions and get helping with the problem. So it's very important to them. And so they have never laid anybody off. Their training is so intensive. You know, how many of us really understand the tax code? So one of the things that they do is they invest a lot of time and resources in getting these call centers, the employees of the call centers, up and trained. So they never want to, you know, ramp everything up, have everything done by April 15th, and then lay off. They, you know, have the employees throughout the year round. And so with the, as I said, with the $200,000 investment, which it could go over that some, we just don't know where it is. Drake will pay about $5,500 in taxes over the 5 years on the new investment. County will grant back 45% to Drake on the capital investment, potentially granting an additional 5% on the average wages paying near the county average wage. County also grant back an additional 3% for paying more than 50% of the employee's health insurance. If Drake adds an additional 20 jobs, county would grant back an additional 5% on there. So all in all, that would be, you know, around $3,200 if they hit all 58%. So a big thank you needs to go to CC Hips for working on this project. And we couldn't have done this without the help of the town of Waynesville. The town of Waynesville went back and redid a lease to provide parking for the employees at Drake. As I said, this is going to be at Depot Street. There was a parking area next to the armory. The town was gracious enough and went back to that property owner and redid the lease to where the employees from Drake would have a place to park. If, you know, all these things had not fallen into place, we unlikely would have gotten them landed over here in Haywood County. So a big thank you to the town manager, Rob Hotz, Gary Caldwell, the mayor, Julia Boyd, Chuck Dixon, John Faulkner, and Anthony Sutton, the alderman there at the town of Waynesville. A big thank you to them. They were in lock and step with us getting this project done. So, any questions?
All right, so we'll have another public comment period right now concerning the economic development grant with Drake Software LLC. Would anyone like to comment on this? No. See no one, I'll close the public comment period. Is that all, Dave?
Okay. All right. Thank you.
Thank you. Okay, we'll move. Their next order of business is the public comment session. And of course, everyone has is limited to 3 minutes. And there's, I guess, is it still up there? Okay. So if you'll just limit your comments to 3 minutes, and then I have a couple people signed up to speak. So our first speaker will be Eric Overholtz. Welcome, Eric.
Good evening. My name is Eric Overholtz, and thank you for pronouncing my name correctly. Most people don't. I'm at 26 Davis Lane in Waynesville, and before I get into my comments, just to give you a little background on myself, I retired up here with my wife in 2017 after serving for 30 years with the Broward County, Florida Sheriff's Office. I retired as a lieutenant there. My entire career was working in the Department of Detention. So I know a thing or two about jails. I have actually visited the jail here in Haywood County a few years ago, a guest of Sheriff Christopher, and I was very impressed with the operation there that you have. Having said that, I can't stress enough, you folks really need the jail annex. I know the $16.2 million price tag might seem steep, and it's a lot of money, but it is something that is needed, is desperately needed. Right now, they're at full capacity. They're actually sending inmates over to other counties. That is something that shouldn't really be happening. In effect, this county has been operating under a catch and release type of system because we simply do not have people that otherwise would be in jail for criminal offenses. We can't keep them there. There's just not room right now. I've heard a lot of cries from the far left the last couple of months, people saying that we do not need any new jails. We need to decriminalize this, decriminalize that. Low barrier shelters, the whole agenda. And the bottom line is this: it just does not work. It does not work in the county. It's not serving folks the citizens in this county well. I just wanted to stress that those views you've been hearing, that while they're loud and vocal, they do not constitute what the majority of people in this county are really thinking and what we need. We really need the jail. Having worked for 30 years in the jail system, I can't tell you the number of times I've had people come up to me, both inmates and inmate family members, say, you know, it wasn't pleasant when I got arrested, but I must say that it was the best thing that happened to me because it's something that got me off of the drugs that I was on or alcohol. And while it's not a perfect solution, it's a vital first step that this community needs. And we do have NA and AA programs operating in jails. No, it's not a complete rehab program, but it's a start, and it's something that this county needs. So please consider that jail annex. Thank you.
Thanks, Eric. Our next person signed up to speak is Peggy Hanna. Welcome, Peggy.
Hello, my name is Peggy Hanna. I live at 268 Hemlock Street. Before I start my 3 minutes, I would like to say that a longtime county employee is in hospice. Larry Worm Sharp, I'm sure a lot of y'all know him. He worked at the county in the garage. He's in Care Partners. He's not doing good. Okay, now I want to go on to my 3 minutes. Thank you, Mr. Inslee. I have to say, you meeting yesterday mended so many bridges, and it built a new road that I think we can all learn from and start traveling. I want to say thank you, Mr. Long, Brandon, Kirk, and Jennifer. I appreciate what you all do. I want to say I'm probably one of the most outspoken people that come to a meeting when it's an issue about the homeless or the drugs. We have had no real solutions being offered, no alternative. At this time, we do have something being offered. I beg each of you to look at it, study it, and see if you feel like it is something that would work for Haywood County. It's nothing that's ever been tried in Haywood County. It does have a good success rate. Everyone that has viewed the facility has come back with rave reviews. Second of all, homeless is not our only problem, and drug addiction is not our only problem. We have a criminal problem because sadly in our world they are people that belong in jail. We need the jail built. We need to work on each solution. There's no magic wand, but if we can build a jail and we can start a rehab facility to help the ones that are addicted, then that will allow us to help the true homeless and maybe begin to see some progress in this county instead of everybody just running around in circles and getting nowhere. Thank you very much.
Thank you, Peggy. That's all the people we have signed up. Would anyone else like to address the board tonight? Seeing no one, I'll close the public comment session. And we'll move on to constituent concerns. Brandon, do you have any want to comment on?
I did have a few. Matter of fact, I had a couple that come up today. I'll be getting with Mr. Moorhead on after the meeting. So.
Okay, Tommy, you have any?
Same. I've had to contact county manager and other staff members, but I think nothing outstanding.
Okay. Anything, Jennifer?
Nothing outstanding, no.
Okay. Kirk, you know?
No, there's a few of the continuing ones that we're working on.
Okay. Okay, our next order of business is administrative agency reports and presentations. And tonight we have Closing the Gap, Mr. Casey Cooper, the Chief Executive Officer of the Cherokee Indian Hospital Authority tonight. Welcome, Casey. Appreciate you coming tonight.
Thank you, Mr. Chairman, and thank you for the opportunity to come and share a little bit of information with you. Maggie's going to hand you out some information. Some of it I think is already in your meeting packet.
Thank you.
Over the next few minutes, I'll just kind of begin with the punchline on this first slide. And the bottom line is I'm here on behalf of the Cherokee Indian Hospital Authority and the Eastern Band of the Cherokee Indians to hopefully get your support and advocacy in closing the coverage gap in North Carolina. In Haywood County, according to the study commissioned by Cone Health, which was completed by George Washington University, it appears that about 23% of working non-elderly adults in Haywood County are uninsured, and it's estimated this is about 3,200 or 3,400 folks. Expanding coverage and closing the coverage gap would lead to about 99 jobs and result in $500,000 a year in new county revenue and about $19.6 million per year in new business activity. The entire details of this study, I'm satisfied you folks have probably already seen this, but if you haven't, it's easily downloadable from the Care for Carolina's website, or I can make it available to you. I think this data has been pretty well vetted. This data has been used over the past year in a number of public meetings and was also part of the data that was used in the Governor's Task Force on closing the coverage gap. In addition to that, for the Eastern Band of the Cherokee Indians, we believe that we have about 1,000 uninsured patients who would immediately qualify for Medicaid expansion if expansion was extended to non-elderly adults up to 133% of the federal poverty level. And in Cherokee, this represents about a $7 million increase in annual revenue at no cost to the state of North Carolina. And I'm going to talk to you a little bit more about that. If the tribe, and let me just be very clear about this $7 million is already being the $7 million worth of health care is already being provided by the tribe and is being 100% funded through gaming revenue now. We have a health system where our patients are entitled to services without the ability to pay. And for that reason, we don't have an access constraint that's based on coverage. Patients still receive the care, and I'm going to tell you a little bit more about that. But I'll also explain to you how this policy decision at the state level is actually costing us at least $7 million a year, and it would be zero cost to the state. So you guys are well aware of this, but let me just be horribly overt. The western part of North Carolina has the highest rate of working uninsured people in the state. Now, fortunately, Haywood County kind of falls out of the worst population. Your uninsured rate is closer to 14.5% according to this data, but you know that all of your neighbors in the western part of the state are suffer significantly from low coverage. As a matter of fact, several of the counties are in the top 10 worst covered counties in the state, particularly Graham County and Swain County. And they're at above 22% of their population, their working population, do not have coverage. And this is significant, of course, for Haywood County. Not only do you have a fair number of folks, a little over 3,000 that are without coverage, but obviously your healthcare system provides a tremendous amount of service to folks that come from the western part of the state who don't have coverage. This table just kind of gives you an example of the uninsured rates in North Carolina, with North Carolina having an overall uninsured rate of 13.8%, and Haywood County is actually higher than the state's overall rate. But fortunately, you don't hit in the top 10 but you're not very far away. So what is this? What's this about, and how do folks end up in the coverage gap? And for those of you that have experience in the insurance industry, this is very familiar to you. This is no secret. You probably, like my dear friend who's a Farm Bureau agent in Graham County, he sees families every single week who have to come in and drop their coverage because it's no longer affordable and they fall in the gap. They make too much money to qualify for Medicaid and they don't make enough money to qualify for the federal subsidies to continue to purchase care on the exchange, and it is completely unaffordable for folks. So this is how you fall in the coverage gap. If you're above 42% of FPL as an adult, then you don't qualify for Medicaid. And then the subsidies, the marketplace subsidies, don't kick in until about 100% of federal poverty level. And so folks that are in this gap are literally going without coverage. And unfortunately, the majority of them are moms. So this is how a parent falls into the coverage gap. If you've got a single mom with one child, and she's making minimum wage, then her annual income is $13,000 a year. So she's making too much to qualify for Medicaid and not enough to afford coverage. Some of the most recent data that I saw, and obviously there are people in this room that have more experience in this than me, but the most recent data I saw is that a person that falls in this gap, the monthly premiums would be somewhere between $350 and $450 a month, with a maximum out of pocket of about $8,500 a year. So you can see that this is clearly not affordable for a mom whose total annual income is $13,000. Are those premiums close?
Very close.
Okay. So here's the other thing that we want to make sure that people know. The folks that lack coverage in the state of North Carolina are not lazy, worthless people who refuse to work. To the contrary, the majority of them are already working. They are working poor, and they can't afford the coverage, just as I explained. This graph shows you that about 63% of the adults who are eligible, who would be eligible for Medicaid, are already working. And these are some of the occupations, this will show you that the folks that are working that lack coverage, they are represented in a number of these occupations, but food service, food preparation and food service being among the highest, having among the highest uninsured, right? I mean, they've got so many folks that are working, and their pay, and sometimes their pay is based on gratuity, and so it's not possible for those folks to have coverage. The next the next couple of slides I'm going to show you are not from the George Washington University survey. They're actually from another survey that was done by Georgetown University. And this shows you that even though African Americans in North Carolina represent about somewhere between 22 and 24% of the total population, it's obvious they are overrepresented in some categories, but they do not represent the majority of uninsured workers in North Carolina. The majority of uninsured workers in North Carolina are not African American. The next slide shows you that with the exception of administrative support and waste management services, the majority of the uninsured are also women, right? And based on the figures that I just shared with you, hopefully it's clear to everyone why there are so many moms in Haywood County in western North Carolina who manage to get their babies on Medicaid and they themselves go without coverage. They are having to neglect their own care because they can't afford it. So it's also veterans, unfortunately, who lack coverage. If veterans don't have a service-connected eligibility, contrary to what a lot of people believe, veterans don't have access to health care. According to this data, 12,000 North Carolina veterans are under the age of 65, have incomes less than $16,000, or $29,000 for a family, and they too fall in this gap. So what is the impact of uncompensated care on hospitals? Before I mention this to you, I will tell you that I have not had the opportunity to speak with your CEO of Duke Life Point in Haywood yet. We are scheduled to meet in the upcoming weeks. But Duke Life Point has already signed on to the statewide coalition, as has Duke Health System, the North Carolina Medical Society, the North Carolina Health System Association, and probably close to 50 other major organizations that have signed on to the Care for Carolinas Coalition that is advocating for closing the coverage gap. The reason for that is that it is obvious that uncompensated care is one of the biggest threats to rural health systems. I know that you guys know this, but the biggest challenges that hospitals face is how to cover the expense of uncompensated care that lands in their emergency rooms and their ORs, et cetera. And many of us know about the cost shifting that happens in hospitals. Why does it cost $400 to get an aspirin? That's an exaggeration, of course, but you've all heard these stories. Why did it cost me $3,000 for an ER visit when the physician was only in there for 10 minutes and they gave me Tylenol? Well, it's because the total cost of providing all that care is unfortunately being carried by commercial insurers. Commercial insurers have known this forever. And as there's more and more consolidation in the insurance industry, then the bargaining power is tightening up, and it's making it more and more difficult for hospitals to be able to cost shift and continue to make their budgets and have positive operating margins. And that's why 82% of rural hospital closures have been in non-expansion states. And North Carolina's had 6 rural hospitals in North Carolina have closed since 2010. And several are at high risk now. And Steve Heatherly, the CEO of Duke LifePoint Harris Swain, told me that they believe that Medicaid expansion would represent an additional $5 million a year at least in revenue that would help them offset the cost of indigent and uncompensated care in their system. So you've also heard the stories about Medicaid expansion is too expensive. The state of North Carolina can't afford it. You've heard all these stories, right? The feds are going to stick us with the bill. We can't afford it. We can't afford it in out years. There's a lot of rhetoric out there. But the truth is, Medicaid expansion, according to the Duke Margolis Center, is the total cost is projected to be about $5 billion a year, 90% of that is funded by the federal match. The state is only required to come up with a 10% state match, and the state and the hospital systems and the insurance companies have already agreed to fund that 10% with increased assessments on the health systems. So the governor's budget, my understanding, the governor's budget has already laid out a plan that would implement expansion with zero cost to the state overall. And if we expand it in North Carolina, that brings in an additional 4.6, and then ultimately in the out years, an additional $5 billion a year in federal revenue to the state of North Carolina that will go into the health system. And most of the data will demonstrate that money spent in health care has an economic ripple effect of 3 to 1. So every dollar in health care has an economic ripple effect of $3. Okay, that's why those numbers that you saw early on from the impact of the potential impact on the Haywood County are so large. Okay, now in addition to this, many of you guys are really familiar with this, but when the American Rescue Plan was passed, the Biden administration added additional incentives for states that had not yet expanded. And these additional incentives are an additional 5% match on the existing Medicaid for 8 quarters or 2 years following expansion. So to put it plainly, for the 2-year period following expansion, North Carolina would receive $1.7 billion as just a bonus, a benefit. And in the early years, if you look at this graph again, you see that the estimated state share is roughly $300 million, growing to $500 million. So the $1.7 billion could easily be used to fund the state's share for the next 3 to 5 years while the hospitals and health systems adjust and prepare themselves for the assessments. This can actually happen with no increased financial burden on the state of North Carolina. You've also heard the stories or the questions. Well, what if the feds renege on this deal? You can't trust the government. What if they refuse to pay in the out years? Well, let's talk about it. This excerpt is pulled directly from the Social Security Act as amended. Okay? This is, if you look it up, you can go to 42 U.S.C. 1396D, and this language is in there because when the Affordable Care Act passed it resulted in amendments, permanent amendments to the Social Security Act, and you see in item E that 90% for calendar quarters in 2020 and each year after is the government's commitment to funding the federal match at 90% into perpetuity, or until Congress passes a bill in the House and the Senate, and then they agree to amend the Social Security Act, which is not an easy thing, right? So for the most part, I think you can reassure your constituents that the government has committed to the 90% match into perpetuity. Okay? The promise is there. So now I'm going to transition just a little bit. I'm going to tell you a little bit more about who we are, and I'm going to talk to you about why Medicaid expansion is unique to us, and why on behalf of the Eastern Band, I am here trying to get your support in passing this resolution. So I'm the Cherokee Indian Hospital Authority. We're we're your neighbors across the mountain here. We're about $100 million a year health system with about 700 employees. We're a small rural hospital, and we've got locations in Swain, Jackson, Graham, and Cherokee counties. We have an immediate care clinic. We've got a robust continuum of behavioral health services and a couple of small clinics out in Graham County and Cherokee County. And we just completed a 80,000 square foot crisis stabilization unit. The crisis stabilization unit is a 14-bed locked facility that allows us to completely unplug ourselves from the state mental health system. Okay? We have the ability now to take those involuntary commitments in the emergency room that historically were housed in the ERs for weeks and sometimes months at a time, and rather than waiting on the crisis stabilization or crisis response team to come in and work these patients up and then spend weeks and months trying to get them a bed at a state facility, we literally take them up a secured corridor through a secured elevator. We take them onto a locked unit, put them to bed, give them some medicine, and get them into therapy and treatment the next day. We have the ability to do that, and we are doing it because of the Eastern Band of the Cherokee Indians. The tribe funded 100% of this facility. There's no federal money involved, and the tribe is funding the operating expense. The operating expense for this unit alone is a little over $3 million a year. It's closer to $3.5 million a year in operating expense. The majority of those patients that we're taking care of are adults below the age of 65 who are below 133% of the federal poverty level. The tribe is literally funding the federal government's obligation to provide the health care for those folks. And I'm going to show you a little bit more about that. So we also have a pretty robust behavioral health outpatient unit with a medication-assisted therapy program, and the tribe also built a 20-bed residential treatment facility out in Graham County. Again, all of these services are for folks who suffer from substance use disorders who are below 133% of the federal poverty level. We just built a women's and children's home where we can house moms and babies who are trying to transition back into the community and who lack safety in the community. The Indian Health Service is a small agency within all of HHS, and the Indian Health Service has this, is responsible for carrying out the federal government's legal and moral obligation to provide health care services for American Indians and Alaska Natives. Unfortunately, the Indian Health Service is horribly underfunded. It's estimated to be funded at about 50% of the level of need, and you can see from this data that even in 2019, the Indian Health Service was funded at approximately $4,000 per capita. That's $4,000 in the context of about $12,000 per capita for Medicare spend in this country, and about $8,500 per capita for national spending in this country. So you can see that it's woefully underfunded, and that's why the Eastern Band is having to subsidize it so significantly. Well, our net patient service revenue now represents 45% of our gross revenue, and our Indian Health Service appropriation is now reduced to just 30% of our total gross revenue. We are heavily dependent on third-party reimbursement, and I'm going to explain to you in a few minutes why. But first, let me lay a bit of foundation for you. This map represents the original Cherokee Nation and the 36 successive treaties that essentially eliminated the entire land base for the Cherokee Nation. So in each one of these treaties, the Cherokee Nation lost more and more of its land base until we got to the Treaty of New Echota, which most of you are probably familiar with. It was the Treaty of New Echota that resulted in the Trail of Tears, that resulted in the forced removal of American Indians throughout the Southeast, where it's estimated that over 16,000 Cherokees were rounded up, put into stockades, and then forcibly marched to what is now Oklahoma, and approximately 4,000 members of the Cherokee Nation actually perished either on the trip or as a result of the trip. Tribes across this country entered into treaties and lost all their land base, just like the Eastern Band did. And in more than 22 treaties between the United States and tribes across this country, the provision of health care was specifically identified, promised as recompense for these atrocities. That's where this foundational legal and moral obligation to provide health care comes from. It is continued in a number of successive pieces of legislation, including the Snyder Act. It's furthered in the Transfer Act, the Indian Reorganization Act, the Indian Self-Determination Education and Assistance Act, the Indian Healthcare Improvement Act, and ultimately the Affordable Care Act. All of this legislation further memorializes this legal obligation to provide health care. But as I mentioned to you, because it's discretionary, it's in the discretionary budget, and it's not an entitlement like Medicaid and Medicare, it's horribly underfunded. Well, Congress, in its wisdom, decided, number one, it acknowledged that Indian health was horribly underfunded. So Congress amended the Social Security Act twice to make it possible to supplement the Indian Health Service by allowing Indian health systems to bill Medicare and Medicaid. Right? So Congress said, okay, you're funded at about 50 cents on the dollar, and that's bad. But you're in the discretionary budget, and we can't fix it. So we're going to let you bill Medicaid and Medicare, and we're going to amend the Social Security Act to allow you to do so. So supplement, augment your budget by doing that. And that's exactly what we're doing. But now, because North Carolina is one of 12 states that has failed to expand, it's costing us $7 million a year because of a policy decision at the state level, right? And one of the amendments that Congress put into the Social Security Act is it guarantees every state 100% federal match for all the money that the state spends on Medicaid beneficiaries who are American Indians receiving care from an Indian health system. So every dollar that is spent, every Medicaid dollar that is spent in our health system for a Native patient is reimbursed to the state of North Carolina at 100%. So this $7 million shortfall, again, would cost the state nothing. There's more information in here that just talks to you a little bit more about the amendments and the legislative history that I was talking to you about. But let me just kind of wrap up by restating again that we estimate that about 1,000 of our patients would qualify if Medicaid was expanded. We think it represents about $7 million annually. Because of the FMAP, it would cost the state nothing. And barriers to enrollment do not decrease demand in our system. Our patients come and they receive care regardless of their ability to pay. The cost is borne by the tribe. So let me just close with this. Hopefully I've addressed this. There are some common misunderstandings out there about Medicaid expansion. The first one being that, people in the expansion population are just worthless people who don't want to work. That is clearly not the case. The data supports it. The state match is unaffordable and not sustainable. Clearly it is. As a matter of fact, it is possible for the state of North Carolina to pass expansion with zero cost to the state. And then finally, the misconception that the federal match might go away in the future, and it's just as safe and secure as every other provision in the Social Security Act. So with that, I thank you for your time, and I'd be happy to entertain any questions that you have.
Anybody have any questions? You, Kurt?
Yeah, I have a few questions. Have you spoken to the legislatures who cover WNC Western North Carolina about this? Have you spoken to the legislatures, our representatives, about this? Yeah. And so what is their response to
I have not spoken with Representative Pless, though I would love to. As a matter of fact, if I can, I look forward to having that opportunity. I have discussed this at length, of course, with Senator Corbin and with Representative Gillespie and Mike Clampett. I think it's fair to say, and I don't want to say anything that would misrepresent where they are, but I can tell you what my reaction, or what the reaction was that I received. The reaction I received from them is, we don't disagree, but it's a heavy lift, and we don't think the GOP is going to support it. And so here's what we know, they don't disagree with the data. The data's clear. And they see the adverse impacts on their health systems and their communities of having large uninsured populations. But here's the most recent information that we have. Chief Snead was in Raleigh all last week. He had a number of meetings with representatives on both sides of the aisle. And the general wisdom, if you will, down there, the consensus is it is not likely to happen this year. It's not likely that North Carolina will expand. It was not in the House version of the budget, and it's not likely to be in the Senate version of the budget. Therefore, there is technically no reason to conference on it. But there are a few people saying that there's still a possibility that it could come out of a conference report and be put in. It's clearly a priority for the governor. And some things that have happened over the last year, of course, is the $1.7 billion worth of incentive payments that are now available since the passage of the American Rescue Plan.
Anybody else have any questions? You have anything, Jennifer?
No.
I was wondering, what are the other counties that have passed the resolution that you asked?
So far, I've only been to Swain County and here. Tomorrow I'll meet with Jackson County, and then the first week in August, I'm scheduled with Clay County, and I'm waiting to get a time with Macon County and Cherokee County.
Okay. And Graham County, or?
Graham County passed this a year ago.
Oh, okay.
Yeah,
okay.
Trust me, they're on board in Graham County. They're suffering horribly. Graham County is one of the most disparate, if you will, counties in the state, obviously. And they have needed access to health care in Graham County for decades. But there will never be supply until there's paying demand, right? Until they have a larger proportion of insured folks out there, the supply will never move into that county. And that's unfortunate. The horror stories that they tell of having to, travel an hour and a half for the emergency room, I mean, it's significant.
Yeah. Do you get a lot of Graham County residents at your hospital?
We do, but they're primarily native.
Right.
But one of the things, thank you for asking that question. One of the things I wanted to mention, we built this robust continuum of behavioral health services, including the crisis stabilization unit. And as you can imagine, because of economies of scale, there's a minimum critical mass that you have to build. We have a tremendous amount of capacity that's available now. 14-bed unit, we are consistently at about 7 to 8 patients. So we roughly are about 50% occupancy. We could make that available to the residents of Western North Carolina tomorrow if they had coverage. There is a requirement in the Indian Healthcare Improvement Act that says, that basically allows us to exercise our authority to extend eligibility. But there's 3 criteria that you should meet. Number 1, the service we're providing can't be reasonably available within the area. Clearly it's not. There is no access to crisis stabilization really anymore. The second is it cannot result in a decrease in service to natives because of the federal funding. And the third thing is you have to be able to charge a minimum of the cost of the service so that it's clear you're not spending Indian health dollars on non-natives. So if the population out here had more coverage, we could make that capacity available to them almost immediately.
Anybody have any questions?
Where in the state do you see the most opposition and the most support? I mean, I know you're here on behalf of the Eastern Band of Cherokee, but I mean, as far as the state goes, I mean, you've got to have those legislatures to pass this and support this. So where do you see the opposition? I mean, is it clearly along party lines or? Oh, there's no question. There is no question. It is clearly along party lines. As a matter of fact, there was, I think it's House Bill 605, I think it was, that was submitted by Lambeth, who is Republican, but he's also a hospital administrator, or has that experience. That was actually submitted in the previous session
of the General Assembly, but it was bipartisan, but it never made it out of the House. So it unfortunately, you know, and I don't say this disparagingly, unfortunately, it is very, very partisan. Clearly, the governor wants this. This was the reason he vetoed the budget. There's no question about it.
Okay, thank you.
Yeah, I've spoken to Kevin Corbin, Senator Corbin, about it, and he had told me that he had evidently the feds will cover 90%, and he said the hospitals were going to cover the other 10. So he had told me, I know he's for it, and he had told me that and everything. So, but I'm not sure how it's going down there. But we'll look over the information and consider this, and I'll have Bryant get back with you and let you know.
Thank you, Mr. Chairman. If you know, if this Board of Commissioners saw fit to pass the resolution, I think it'd be a good symbolic gesture to provide the Republican representatives in the state some cover to say, we get it, thank you, you did a great job. You know, being fiscally conservative has served us very well because now there's an additional $1.7 billion in bonuses. So thank you, and the time is right. Let's do this now. Thank you.
Well, thank you for coming, Casey. Okay, our next order of business will be discussion adjustment to the agenda. I don't have anything. Does anybody else have anything? Okay, and then after that, our next order of business is a consent agenda. Does anyone have any questions about the consent agenda, any of the items on the consent agenda, 1 through 6? Hearing none, I'll entertain a motion. We approve the consent agenda.
So moved.
For a second?
Second.
Okay. Any discussion at all? All those in favor indicate by saying aye. Aye. Is anyone opposed? Okay, that's unanimous. Okay, next we'll move to the regular agenda, and we have a proclamation recognizing the Kiwanis Club of Waynesville for their 70th year. And I know we have a representative tonight, Wilson Strickhausen. Is Wilson here? Would you like to come up, sir? Just let us know. How are you?
Fine. How are you today? Are you going to be reading the proclamation?
Well, would you like us to read?
Yeah. I don't have a copy with me.
Yeah, will you read it, Kirk?
Yeah, sure. Sure, I'll read the proclamation. This is the proclamation recognizing Kiwanis Club of Waynesville's 70th year. Whereas the Kiwanis Club of Waynesville has a rich and storied 70-year tradition of providing for the children of Haywood County and is a part of a global organization of volunteers dedicated to improving the world, one child and one community at a time. And whereas, in addition to improving lives, Kiwanis Club members promote the development of community leaders, positive role models, intercultural understanding and cooperation, opportunities for fellowship, personal growth, professional development, and community service. And whereas the Kiwanis Club of Waynesville has a unique partnership with the Haywood County Schools with the annual 3rd grade dictionary distribution, sponsors key clubs in 2 Haywood County high schools, and sponsors the Actian Club for adults living with developmental disabilities. Each of these clubs continuing the Kiwanis tradition of service projects and community service activities. And whereas the service provided by the Kiwanis Club of Waynesville will continue to have a positive impact on our community and citizens, and whereas the Kiwanis Club of Waynesville is acting as a partner with Waynesville Parks and Recreation to make significant improvements to recreation in Kiwanis Park, and whereas with the generous annual funding source through the Jim and Betty Scott Fund and the funds raised each year, Kiwanis has been able to fund grants, scholarships, and sponsorships during the past 70 years, equaling more than $1 million. Now, therefore, be it proclaimed that the Haywood County Board of Commissioners do hereby call upon all citizens to recognize the Kiwanis Club of Waynesville's 70 years of meaningful and invaluable service and honor its members for their contributions to the betterment of life in our Haywood County community. Adopted this 19th day of July, 2021.
Okay. Thank you very much. I have the honor of serving as president of the local Kiwanis Club, and this is our 70th year, as evidenced by the proclamation. And you can imagine, over the past 70 years, thousands of hours, of volunteer hours have been given to the community. And probably, this is a conservative statement, perhaps hundreds of thousands of dollars have been raised primarily for the children of Haywood County, because Kiwanis believes that when you enrich the lives of children, you enrich the lives of the whole community and family. So we're dedicated to our community. And through the past 70 years, we have awarded grants to schools for different projects, for social agencies, child care facilities, any organization that has something to do with children. We have aided them and helped them. And a little-known aspect of Kiwanis is what we call our servant leadership projects. So many different levels of education, we go into the schools and we aid them with leadership skills, community service. And we have a club in Tuscola High School. We have one in Pisgah. And right now we have one in Western Carolina University. Now, because of the pandemic this past year, we've been limited in-person meetings going into schools. So we've had to do a lot of virtual fundraising. And when the pandemic broke out, we also were selling masks to businesses so they could distribute them. And we are now just donating the masks that we have. But so we've been able to concentrate this year on the signature project of the Kiwanis, and that is the playground in Waynesville, a playground that has been furnished and developed by the Kiwanis over the years in conjunction with the Waynesville Parks and Recs Department. But as you know, as things get older, they begin to diminish. So this year, we have devoted time and money to improving this playground. We've added a tot lot, or in the process of adding a tot lot, which is for younger children. We have an all-abilities playground. And I would suggest to you or anyone else, if you have some free time, to go down there sometime during the day. And it's a real joy to see those parents and children during this pandemic, finding an open, safe place where they can go and exercise and have a lot of fun. Well, there's a big day coming up because we're going to have the official blessing or opening of the playground coming up September the 25th. It's going to be a ribbon cutting beginning at 10 a.m. And the rest of the day is going to be a day of festivity. There's going to be games. There's going to be free hot dogs. There's going to be demonstrations and exhibits. It's going to be a great day on September the 25th from 10 a.m. to 3 p.m. So it's a real honor for me to be part of this great organization, and I really appreciate the recognition that the county commissioners are giving to us today. Thank you very much.
Thank you, Mr. Strickhausen. Thank you for coming tonight. Okay, our next order of business will be appointments.
You want me to move to approve that resolution?
Yes, I'm sorry.
I'll move to approve the resolution.
Sorry.
Second.
Okay, all in favor indicate by saying aye.
Aye.
Okay, thanks, Kirk, for keeping me on
And
track.
thank you. That was well spoken, sir. Thank you.
Okay, the next order of business is appointments, and the first one is the request approval to appointment for Dr. Shelley White, President of Haywood Community College, to the Haywood County Tourism Development Authority Board as the Clyde Municipal Representative.
So moved.
Okay, second?
Second.
Okay. So you're under discussion. All those in favor indicate by saying aye.
Aye.
Okay. And the second item of appointments is to request approval of appointment of Vice Chairman Brandon Rogers to serve a 2-year term on the Fritz Broad River MPO Board to represent urban and rural transit providers. Haywood County is the newest urban transit provider in the French Broad MPO. And did you want to say anything about this, Brian? I guess, go ahead.
Haywood County is the newest member of this MPO, and this will be the first appointment we have, and Mr. Rogers has agreed to serve its 2-year term.
I move to approve the appointment of Mr. Rogers on the Prince
second?
Broder River MPO Board.
Second.
Okay. All those in favor indicate by saying aye. Aye. Okay, that's unanimous. Okay, our next order of business is closed session, and it's acquisition of real property, 143-318.11A5. I'll entertain a motion. We go into closed session.
So moved.
Second.
Okay, all those in favor indicate by saying aye.
Aye.
Okay. Okay, we'll be in closed session when we enter the chambers in the back. Amy, do we want to give one of these to Mr. Strickland?